Have you ever wondered what bipolar disorder is? This complex condition, recognized by extreme mood swings from manic highs to depressive lows, significantly impacts emotions and day-to-day life. Symptoms can be as diverse as the people it affects, and it's more common than you might think, affecting millions worldwide. It doesn't discriminate, touching the lives of people from all walks of life, regardless of age, race, or social standing. Now that you have a basic understanding of bipolar disorder, let's delve into its history. The understanding and interpretation of bipolar disorder has evolved considerably over time. In the grand scheme of human history, the recognition and understanding of bipolar disorder is a relatively recent development. Yet the traces of this disorder can be found as far back as the times of ancient Greece. Greek physician Hippocrates in the 4th century BC described a condition which we now recognize as bipolar disorder, terming it as mania and melancholia. Moving forward to the 2nd century AD, the Roman physician Arrhenius of Cappadocia also documented cases that we would today classify as bipolar disorder. However, the link between the depressive and manic episodes was not fully recognized until much later. The 17th and 18th centuries saw further development in the understanding of this disorder. The term mania was commonly used, and the depressive aspects started to be recognized as part of the same condition. Fast forward to the 19th century, French psychiatrist Jean-Pierre Faure coined the term folie circulaire, or circular insanity, to describe the cycling between mania and depression. This was a significant leap in understanding the nature of this disorder. The term manic depression came into use in the early 20th century thanks to the work of German psychiatrist Emil Kraepelin. Kraepelin's work was revolutionary as he was the first to distinguish bipolar disorder from schizophrenia, a critical differentiation that still stands today. In the mid-20th century, the term bipolar disorder was introduced, replacing manic depression. This was part of an effort to reduce stigma and more accurately describe the condition. In the last few decades, advances in neuroscience and genetics have given us a deeper understanding of the biological basis of bipolar disorder. We've come to understand that it is a complex interplay of genetic, environmental, and neurological factors. Today, bipolar disorder is recognized as a serious mental health condition that requires long-term management. It is no longer seen as a personal failing or a sign of weakness, but as a medical condition that can be effectively treated with the right approach. From ancient times to the present day, our understanding of bipolar disorder has come a long way. What causes bipolar disorder and who is at risk? This is a question many people grapple with. While the exact triggers of bipolar disorder remain elusive, researchers have identified several factors that may contribute to its onset. Firstly, genetics play a crucial role. If you have a close relative, such as a parent or sibling with bipolar disorder, your chances of developing the condition increase. However, it's important to note that it's not a guarantee, and many people with a family history do not develop the disorder. Environmental factors can also influence the onset of bipolar disorder. High-stress situations, traumatic events, or significant life changes can act as triggers, potentially sparking an episode for those already predisposed. Lastly, it's also believed that an imbalance in brain chemicals may contribute to the disorder. These chemicals, called neurotransmitters, are responsible for communication between brain cells. An imbalance can disrupt this communication, leading to mood swings and other symptoms of bipolar disorder. While the exact cause of bipolar disorder remains unknown, these factors can increase one's risk. So how can bipolar disorder be treated or managed? Well, there's no one-size-fits-all answer, but a combination of therapy, medication, and lifestyle changes often proves effective. Psychotherapy is a cornerstone of treatment. Cognitive behavioral therapy, for instance, can help individuals understand the relationship between their thoughts, behaviors, and mood. Family-focused therapy might also be beneficial, as it educates families about the disorder and how to provide support. Medication is another vital component. Mood stabilizers, antipsychotics, and sometimes antidepressants are used to manage symptoms. But remember, it's essential to work closely with a healthcare provider to find the most suitable medication and dosage. Lifestyle changes such as regular exercise, a healthy diet, and adequate sleep can also make a significant difference. Avoiding alcohol and drugs is crucial, as they can trigger episodes or interfere with medication. While there's no cure for bipolar disorder, it can be managed effectively with the right treatment and support. We've covered a lot today about bipolar disorder. We dived into its history, explored its causes and risk factors, and even looked at treatments. From understanding it as a complex emotional disorder to recognizing its implications in our society, we've unearthed many layers of this condition. Remember, knowledge is power, especially when it comes to mental health. Don't miss any of our history topics. Subscribe to our channel today for more stories to hear.